Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome back to another episode of Coaching Healthcare Leaders podcast. So I am your host, Dr. Lisa, and I have another amazing guest with me today that I will be interviewing and sharing their story. So my guest today is Dr. Alexander Itskovitch. He is a senior healthcare executive, hepatobiliary surgeon, and physician scientist. He currently serves as the medical director of the State Cancer Center and American College of Surgeons Comprehensive Cancer Program in Freehold, New Jersey. Dr. Itskovitch serves as a site director for the National Cancer Institute Community Oncology Research Program and is the primary investigator on multiple clinical trials. In 2024, Dr. Itskovitch was recognized by the State Senate of New Jersey for his contributions to cancer care delivery in the region. Most recently, he was named the 2025 Physician of the Year by New Jersey Biz Magazine. Dr. Itskovitch has a special interest in AI and patient-facing AI implementation. He has lectured extensively on healthcare AI, including most recently at the Cornell University MBA program. So welcome to the podcast.
Oh, thank you very much.
Yes. So
Thank you for having me.
Thank you. So I'm really excited to learn about your career journey. As it's always interesting, when I hear about such subspecialties within, the field of medicine. So share with us a little bit about your career journey in healthcare and how did you arrive at where you are today and who or what may have been instrumental in that?
So I've been very, very fortunate with some incredible mentorship in my life. And I would say that, some people don't know what they want to do with their lives. I've known I wanted to be a surgeon since I was 6 years old. It was just never a question for me. And although I did veer off a little bit in college, and then I came right back. And For a moment, I was thinking about primary care, but I quickly came back to surgery. So I grew up in Brooklyn, and I did my residency training in the New York Presbyterian system. I subsequently went on to fellowship in advanced GI surgery, and then I got my first job out of residency in Brooklyn Hospital, which is in downtown. Had a really wonderful experience there, and started to take on some leadership roles in the center, working with the quality team, looking at patient outcomes. I had done some research to the National Surgical Quality Improvement Project in residency, and so that kind of took on its own role. And then I moved on to work for Hackensack Meridian in New Jersey. It was actually a private practice. I joined a senior surgical oncologist who had been in practice in the area for 30 years. Was a wonderful mentor to me for the time that I was with him. And over the course of that, approximately 5 years, I took on progressive leadership roles within the organization. I became assistant director of general surgery, was involved in a lot of quality improvement projects, took on some additional physician advisory roles within some of the smaller hospitals in the network. And then my senior partner was retiring, and so I had this sort of this pivotal moment, and I got an opportunity to join Atlantic Health, where I am now. They had a community cancer center that they had just acquired as part of a merger with one of the local healthcare systems, and they needed somebody to run it. And so they said, "What do you think?" And so I thought about what that would mean, and it would require a substantial amount of time to go into administrative work, which if yeah, anybody knows me, I love being in the operating room. So it was an a challenging decision, but I decided I thought I could really have a big impact on the community, and so I took on the role as cancer center director, and I've been in it for about 4 years now, and it's been just absolutely the best experience of my career.
Wonderful. Yeah, and for those people who may not be aware of maybe the training that it takes for you to get to become a hepatobiliary surgeon, tell us a
Mhm.
little bit about that training, like, how many years, the fellowship, and all involved.
Well, I mean, you have 4 years of college and 4 years of medical school to get your MD, and then it's 5 years of general surgery, and then it's another subspecialization year to become trained in diseases of the liver, pancreas, and bile duct. These are very, very specialized operations. They require a unique skill set, and as much as you can learn from textbooks and things like that, this is really an apprenticeship at the end of the day with somebody who's very, very good at it. And I've been so fortunate in my life to just have really great mentors and people who kind of took me under their wing and showed me the ropes and showed me things that would require a lifetime of to acquire yourself. So I think a big part of that is you really do stand on the shoulders of giants when you take on something of this complexity.
Absolutely. Yeah. So thank you for even highlighting how important mentorship is, right? Because as we are sort of facing, what may or may not appear to be, a physician shortage in certain specialties and in certain areas,
Hmm.
yeah, it becomes even more important, right, to have those people who are going to continue to guide us and to lead, those who may need, like you said, that apprenticeship type of
Hmm.
experience to continue to do that specialized work. So, yeah. So thank you for sharing that.
Yeah, absolutely. I mean, I think mentorship is such a big part of medicine. I think, you know, as we as we progress through our journey and through our career, uh, training residents, medical students, even taking on training of other subspecialties. Like for example, we have genetic counseling students in the program where we are. I mean, it's really a privilege, and I think that what you may be doing and is routine for you is maybe the first operation somebody's seeing. And
Yeah.
it's always very exciting to take a medical student into the OR for the first time and just having them experience that. And I remember my first case like it was yesterday. So
Yeah.
it's a
I
privilege.
was gonna say that too. I remember my first OR experience. I think we all do, right?
Hmm. Yeah.
Yeah, it is very exciting.
Hmm.
Yeah. So tell us a little bit about what the day in the life of, being medical director at your center sort of looks like, that in conjunction with, you having obviously clinical responsibilities.
So I sort of balance my time. I have a weekly schedule that sort of dictates what I do each day in terms of both either clinical or administrative work. I have usually 1.5 to 2 administrative days a week, and then and then I say I have 5 clinical days a week. It doesn't matter. I mean, I'm always taking care of patients irrespective. In my clinical time, usually Mondays and Tuesdays, because hepatobiliary surgery tends to have larger cases, so we try to get those done earlier in the week. And so usually Mondays and Tuesdays are my operative days. And then I see patients sometimes Tuesdays and then all Fridays in the office. And then Wednesdays and Thursdays are my administrative days. And those involve a variety of tasks that are required for cancer center. So a lot of it is structural. So looking at things like how we're going to expand programs, looking at hires, interviewing various candidates, doing strategic planning, doing budgeting, looking at each of the areas and where we're having challenges and what those challenges are and addressing those challenges. So I usually have a jam-packed schedule. And then, a lot of it is also done at night. I mean, hiring physicians, taking them out to dinner, working with community leaders, trying to source new sources of patients for the system. So it's a largely a business development role as well as really looking at the quality and trying to impact the community in terms of quality, and that's where really my passion lies. It's looking at this role as somebody who leads population health, and how can you impact a region, in terms of cancer care? And then I can talk to you about specific examples there, but I mean, that's really where I think, physician leaders can have impact on hundreds and thousands of lives.
Yeah, I love that. I love that perspective because I think a lot of times we get caught up in the word leader or what leadership means, and we take on or may think that we need to take on this whole global responsibility where we can really make impacts within right in the communities in which we serve. So
Mhm.
yeah. So tell us a little bit about how you do that. So how does the work that you do impact the communities, in which you serve?
So one of the things I think in cancer particularly that we've learned over the last 20 years is that our biggest impact as physicians is actually in screening and early prevention.
Mm.
80% of lives that are saved from cancer are in that initial group, because once cancer spreads, it becomes much more difficult to manage, and in some cases we are fortunate enough to make it a chronic disease, but in most cases it becomes quite challenging. And so for that reason, screening and prevention is, I think, our number one role, as serving, serving the community from an oncology perspective. So I spend a lot of time in educating the community. We have a lot of various events, and talking about the basics. Get your mammogram, get your colonoscopy. Make sure that if you have a very high risk family in terms of your family history of cancer, make sure you get genetically tested. Understand what that means. And in our center, we run a variety of high risk programs, which I think have a big impact on the community. So one example would be we have a high risk familial pancreatic cancer screening program where we follow families who have pancreatic cancer who meet a very specific criteria, and we follow them yearly with MRIs. And we often find early disease, and are able to intervene at a time before it really becomes the problem that it does.
Sure, sure. Wow, that's great. Because as we know, pancreatic cancer is one of those, cancers, once it's detected, sometimes it's like you said, becomes more of a problem. Um, so having that ability to follow people early on, I'm sure makes a huge impact.
Yeah, I think really, people also underestimate how much logistics plays a role in medicine. So I'll give you a great example. So if you look at national compliance rates with guidelines for pulmonary nodules, you'll find that it's about 15%, which is, I mean, it's unbelievable that, given that lung cancer is one of the top killers,
Yeah.
in terms of, from all of the cancers, that we aren't doing more to help people and guide them into appropriate follow-up. And in communities, and this is now really well established in the literature, where you raise that number, where you take that 15% and say you make it 80%, you could actually downstage cancer at presentation in that community just by fixing the logistics and the
Mm.
sort of the socioeconomic aspects of around how screening is done and or follow-up is done. So I think, our role as cancer professionals is to maximize that,
Yeah.
and maximize people's ability to catch things early so that they don't become a big problem. And this also ties a lot into healthcare costs, because,
Sure.
if you really want to win across all avenues in medicine, and I always say this to, our financial team, good medicine is good business. If you actually think through, for example, what it costs our healthcare system to take care of somebody at a late stage cancer versus an early stage cancer, you'll realize it definitely benefits the patient to be cured, but it also has a significantly lower financial impact as a system if
Sure.
that cure happens and they don't need a lifetime worth of treatment.
Sure. Sure. Absolutely. Yeah. So one of the challenges, obviously that you mentioned is just sort of getting people into a system of, adequate follow-up, right? So that we can maybe slow down the progression of disease and its
Mhm.
impact. What are some other challenges that you see in healthcare, and maybe some suggestions of how we can change how we deliver care, in your example for patients with cancer?
So I think one of the biggest challenges we face right now is just information overload. You know, from new data being available in a variety of disease processes and research progressing at an ever increasing pace, to the fact that a lot of healthcare is disjointed and we don't have access to a certain report because the patient may have had it in a different healthcare system. Um, it's that integration of that information is really the future of medicine. And I think, and that really goes across all fields, all disciplines, all specialties. If we can integrate information better, I think that that's really where we're going to have the biggest impact on lives in the future. Because even now, with all of the research that's happening in cancer, it becomes almost impossible to, even if you're a subspecialist, keep up with all of the literature. And so you do need that um, you know, additional support from information systems to help you. And I think that's where artificial intelligence comes in. And I know some of the, recent innovations that I think they are going to provide us the tools to bridge that gap.
Yeah, absolutely. Yeah, I'm excited about what AI, is going to bring, into
Hmm.
healthcare in terms of just helping us with efficiency, right? And
Hmm.
like you said, taking some of that information and allowing us to retrieve it quicker and to utilize it, also more efficiently as well.
Yeah, I mean, we are using artificial intelligence in a variety of ways in cancer.
Mhm.
I'll give you one great example. So one of the big problems nationally that exists is what are called incidentalomas.
Mhm.
So, somebody goes to the emergency room, they think they have appendicitis. The doctor says, you have gastroenteritis, you don't have a problem, you can go home. And then what happens is that their imaging will show a nodule in the pancreas or a nodule in the adrenal,
Yeah.
and that report may come back in the morning. Maybe that report was read overnight by a temporary read. And so now the emergency room doctor is home, the patient is home, and now you have this finding that's critical. And nationally, it's a big problem that where that finding doesn't reach the patient. They
Mhm.
gave the wrong phone number. A variety of logistical issues that can cause that. So one of the things that we're doing in our system is we're using artificial intelligence to be able to monitor every single incidental finding that's coming through our emergency room and verifying that the patients are getting follow-up for those incidental findings.
Mm.
And, so that's a great way of using, some of the technology that's available to create a safety net, for patients and to ensure that they're, going to get the care that they deserve for, the findings that we do find incidentally.
Yeah, that's very interesting. So what do you think it's going to take for health systems to really embrace? Because I feel like it's still some things that maybe we shy away from. And some systems
Yeah.
are, some systems are really embracing it and others are like, no, not so much. So yeah, what do you think may be helpful to get us to start embracing it?
Well, I think a large part of it is we as a healthcare system, our IT departments are really geared toward the electronic medical record, helping us with billing, helping us with documentation. They're not really geared toward artificial intelligence. And you're lucky in most healthcare systems if you have several people in that system who have any significant expertise in it. So I
Yeah.
think part of the overcoming that is by getting that expertise into healthcare systems, which I think is happening now. And when that expertise arrives in those IT departments, and as they start to dedicate more and more resources to it, and as physicians, we start to educate ourselves about, a lot of the topics in artificial intelligence and how that is going to change, healthcare. These conversations are opened, and then, they bring about really positive change. And so that's really, something that I'm deeply passionate about is, bridging that gap of, the between IT and the medical community, because I think that that's really where we can solve some of the information challenges of the future and really do much better for our patients in terms of outcomes.
Yeah, definitely. Absolutely. So the last thing I wanted to ask you, in terms of like your leadership
Mhm.
journey and what you do now as medical director, there are a lot of physicians sometimes that will take on a leadership role and then they're realizing that they have to manage this whole team, right?
Mhm.
They have
Yeah.
to actually work with other people and
Absolutely.
yeah, and form, what would be a collaborative a team. So tell us a little bit about how you have, embraced that. How do you support your team and what do you find helpful in sort of navigating those dynamics as it pertains to a team?
So I did a lot of work, prior to taking this role in trying to think about, what it means to be a leader and what type of leader I wanted to be, because the team that we do manage here is quite large and is really, really talented. And, how do you, have those people perform at their best and feel supported and empowered and and empower them to take great care of patients. And so I love this really great quote by Richard Branson. He says, you know, your job as a leader is to set the vision, to hire the smartest people that you possibly can, and then get out of their way. And and so exactly what I try to do. I try to really bring in very strong people to our leadership team, set a culture that's very positive, and we everything in terms of our interview process is focused on culture.
Mm.
Some physicians or other team members may be, qualified on paper or maybe even, qualified in other ways. But if they don't fit into our culture, even if they make business sense, we say no.
Right.
Because I think, that culture is such an important part of how you deliver care. And we've been able to find a lot of like-minded folks in terms of how they approach patients, going the extra mile every time. If that extra patient comes onto your schedule at 6 o'clock and they're a cancer case, you're gonna see that patient. Just really understanding and being sympathetic to the patient's journey. And so what I've tried to do is I've tried to do that, lead by example. I think that's the most important thing. If your team sees that you're doing that, they don't have any excuses.
Yeah.
And that's my style of leadership. I'm hands off. I trust my team. I think a lot of leaders get a little nervous about hiring really talented people and how that may reflect on them. I think you have to embrace that. I think the better your team is, the stronger your team is, the better your organization is going to be, and ultimately it'll reflect strongly on you.
Absolutely. I love that. I think that's so important, to let people just be rock stars. Like,
Hmm.
you know,
Absolutely. Yeah.
let them do that, and then also, like you mentioned, the culture that's so important. Yeah,
Yeah.
it's really
Yeah.
important.
I mean, one really, great example that comes to mind. I mean, we hired two really spectacular research nurses, a PhD and a research nurse. And prior to me starting here, I mean, we really weren't enrolling too many people in clinical trials. It was a community-based center, and the two of them are just forces of nature. And I mean, it's just incredible. We've empowered them. They're so clever and just they have so much ingenuity in what they do. And in one of the clinical trials, we were the largest enrollment site in the nation. And it's just incredible for a community hospital to be able to do that, with a small research team. So when you hire people like that and you see that and there's that energy, it becomes sort of a way to move forward. And when you do have your challenging days, that's what keeps you going. As you get motivated by really strong people that you work with.
Yeah, absolutely. Sounds like a great team you have
Hmm.
there.
Yeah, I'm very lucky, very, very lucky.
So as we wrap up, I'm
Hmm.
sure that you obviously are very busy, between
Hmm.
your role, medical director, your surgeon,
Hmm.
a team. Share with us a little bit, maybe some tips around how you thrive in the face of adversity, but also find time for yourself, which is so important as well.
Yeah, I think that's a constant challenge for all very busy physicians. So, I am extremely lucky because I have an incredible support mechanism and my wife and my family and my 3 beautiful boys. And, so I have a 5-year-old son and, 3-year-old twins, also boys. And so we're quite busy at home. And so it's very, very important to me to be able to spend time with them. And I encourage my staff to make sure that they're taking the right time off. In fact, I had a conversation with one of my team members the other day. I said, "What was the last time you took a day off? You need to take a day off." So it's important because our mental well-being, as clinicians, reflects on the care we provide, and it impacts our families, and it's either a very positive cycle or it becomes a negative vicious cycle, and you have to I think you have to balance that. So I really try to set boundaries in terms of taking time off, scheduling time off regularly. I think that's really important. I think a lot of physicians just neglect that because they've got to put on that additional case and that. But if you don't take care of yourself, you're not going to do a good job with patients, and over time, the quality of care you provide will decline if you're not maintaining your both your physical and your mental health.
Absolutely, absolutely, yeah. So I'm glad that you model that for your team as well. Yeah,
Mhm.
really
Yeah,
important.
well, it's I think that's really important, especially we have so much literature coming out now on physician burnout, and as healthcare leaders, we have to be cognizant of that. We have to be cognizant about how our decisions administratively impact people's lives, and so I mean, one of the things it may be a small thing, but when I'm planning out how we're going to expand to say another office or to another location. I am cognizant of where people live, what their commute will be like, thinking about, all of the staff that's going to be going to that office and what it means for them individually in their lives. Those are the type of things that I think make a good leader. It's really thinking about and being responsible for trying to do a good job for the people that you're serving. Because ultimately, being a leader is serving the people that you're working.
Yeah, absolutely, absolutely. Well, this has been a wonderful interview. Thank you so
Mhm.
much for taking the time to share your career journey and your leadership journey and all the great things that you're doing at your medical center.
Well, thank you very much for having me. Much appreciated.
You're welcome. Have a great rest of your day.
You as well.